A 56-year-old man became acutely short of breath after returning home from a family vacation. He urgently presented to our office, almost in code blue. See what happened next. So, Camilo, I remember that day that you called me about this patient, and you shared with me over the phone that this patient just didn't look right. He's someone you had seen before, and we routinely saw. However, there was something different about his appearance. What was going on?
This is a patient I'd see regularly for heart failure, and periodically he'd come in and I would give him IV diuretics to pull fluid off of the heart. But this time, when I saw him, I knew he immediately looked different, and I was going to call 911 right away. When I told him this, he looked very disappointed, and he told me he felt like I was abandoning him. But I told him, no, I'm saving your life. He needed supplemental oxygen. His blood pressure was 202/120, and his heart rate was too fast.
I recall being called by the emergency room doctor upon this patient's arrival. He was immediately given diuretics intravenously because he was very short of breath. Chest x-ray showed that he was fluid overloaded, and he did show some mild response to the diuretics. However, the chest x-ray showed some abnormalities that the emergency room doctor felt was due to pneumonia. Lung specialists or pulmonologists would then call, and they started him on antibiotics. So the next 24 to 36 hours, the patient showed very subtle improvement. However, he never seemed to turn around. Also, there was one significant abnormality in his blood work, which was a white blood count, which was 26,000. Now, a white blood count that elevated could be due to any one of a number of things. When a white blood count goes up, that's due to the fact that your immune system is under stress. That can be due to an infection, an allergic reaction, or an acute stressful event such as heart failure. So this patient had what we thought was pneumonia and heart failure combined. So we were treating him with antibiotics and diuretics. However, after 36 and 48 hours, he still did not get better. The white blood count remained elevated, went from 26,000 down to 23,000. However, it didn't significantly drop the way we would expect it to. His condition really didn't get better. He was on the IMU floor, and we continued to monitor him, and then we decided to do one critical test. Yes, this patient was clearly a mystery because we had done blood cultures, they were all negative. The echocardiogram showed him to be in heart failure, and we were treating him for heart failure. However, there was one other diagnosis that we considered. That diagnosis was potential pulmonary embolism, and the critical test that needed to be done was a CT scan of the chest with contrast. So a STAT CT scan with contrast was done, and it showed blood clots to both lungs. This patient had bilateral pulmonary emboli. This condition has a mortality rate of 30% if not adequately treated. Upon these findings, we immediately went into action. We started the patient on intravenous heparin, which is a blood thinner. We transferred him to the cardiac care unit, and we consulted the pulmonary embolism response team to come and help evaluate this patient. We weren't sure if the patient needed an emergency surgical procedure to remove the blood clots from his lungs, or if we can just simply watch him on intravenous heparin. The next 6 to 12 hours are going to be very important to determine his outcome. During this 6 to 12 hour waiting period, I started the patient on an important supplement. This supplement is known as nattokinase. Nattokinase is an enzyme that dissolves blood clots, and I was hoping that by starting him on a heavy dose of nattokinase, it could potentially dissolve enough of his clots to prevent him from going for this surgical procedure. So after this 12-hour waiting period, we noticed that the patient's oxygen level not only remained stable, but slightly improved, and also his blood pressure remained normal. I discussed these findings with the pulmonologist, and we all agreed to continue treating him with the IV heparin as well as the nattokinase. 12 hours later, his condition improved even more, to the point that we were able to transfer him to a step-down unit out of the CCU. After being transferred to the step-down unit, we then consulted our nutrition team at the Garden Kitchen Nutrition Center, We started him on a special anti-inflammatory raw detox diet. We had the food shipped to the hospital, and he continued with the heparin, the nattokinase, and the raw detox diet for several more days. The white blood count had come down to almost normal, and we then transferred him from the heparin to an oral anticoagulant along with the nattokinase. The patient was discharged nearly 1 week after being admitted to the hospital. So, how was he upon return to the office?
He looked like a new man. He was smiling. He was reunited with his wife. He had no problems breathing. And even though there's more work to be done, I knew he was on the road to recovery.
So there you have it, another success story. If you like this, please click and share this video with others. Of course, if you have any questions or comments, leave them in the comment section. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.